Your body often speaks in quiet ways, sending messages that can be hard to interpret. A subtle shift in how you smell can sometimes be an early warning of a serious condition like cancer. It may sound unexpected, yet the body regularly offers clues, and missing them can cost precious time. Cancer, one of the most destructive diseases worldwide, does not always begin with obvious symptoms. Some of the earliest hints can show up as changes in body odor, on the breath, or in sweat. Think of these scents as early alerts, gentle signals that something is off. Would you recognize them when they appear? In today's video, we reveal 8 cancer-linked smells that many people overlook, signs that could make the difference in catching the disease sooner. This knowledge can be life-saving, so stay with us until the end. Let's get started. You might ask how a disease could change the way a person smells, and the explanation sits in the way cancer interferes with normal physiology. Malignant cells can nudge metabolism off course, prompting the body to generate distinctive chemical byproducts. These byproducts, known as volatile organic compounds, VOCs, may subtly alter the scent of breath, sweat, or urine, creating patterns that differ from a person's usual odor profile. A growing body of research indicates that specific cancers, including lung cancer, skin cancer, and bladder cancer, release recognizable chemical signatures into the air. These markers often remain below the threshold of human perception, yet trained animals, especially dogs, can identify them with striking reliability, sometimes before routine clinical evaluations detect anything out of line. Building on this insight, scientists are designing sensor systems that emulate a dog's extraordinary olfactory abilities. Early prototypes of electronic noses suggest a future in which a simple breath or sweat analysis could help flag malignancies far earlier than many current methods allow. Until such tools become widely available, attentiveness to personal signals remains essential. A persistent, unexplained shift in body odor that does not resolve may be more than a curious anomaly, and treating it as a prompt to seek medical guidance can preserve valuable time for early diagnosis and treatment, a window when cancers are often more manageable and survival odds are better. The concept of odor-based detection may feel unexpected, yet it is rooted in sound science. The body communicates in many ways, sometimes through visible or tangible symptoms, and sometimes through changes in scent that arrive without an obvious cause. Recognizing those changes early can offer critical clues. In the segment that follows, we will outline 8 frequently reported odors that may serve as early warnings for different cancer types. Staying informed and noticing subtle shifts equips you to act sooner, and that vigilance can make a meaningful difference. Let us examine these signals together, because early detection is vital, and your health deserves that attention. 1. The hidden mold, the mouth and throat cancer warning. Cancers of the mouth and throat can be challenging to spot early, and one of the most overlooked clues is a breath odor reminiscent of damp mold or rotting wood. This musty scent can arise when tumors disrupt local tissues, setting the stage for secondary infections, tissue breakdown, and the release of volatile byproducts that alter breath odor. Clinically, persistent halitosis may reflect ulceration, inflammation, and necrosis within oral lesions, and malignancies of the cheek or tongue are among the conditions considered when bad breath does not resolve with routine care. Because the change is most noticeable on exhaled breath, people nearby may detect it during conversation, and it is too often dismissed as poor oral hygiene or routine dental trouble. That misattribution can delay care. The odor frequently travels with other red flags: a hoarse or altered voice that lingers, difficulty swallowing, mouth or throat sores that fail to heal, white or red patches inside the mouth, a lump in the neck, or unexplained ear pain. These warning signs, especially when they persist beyond a couple of weeks, warrant prompt evaluation by an ear, nose, and throat specialist or an oncology team. Diagnosis rests on targeted testing. A biopsy remains the only definitive way to confirm cancer in suspicious oral patches or non-healing ulcers, while imaging such as CT or MRI helps define the extent of disease and guides treatment planning. PET-CT may be used for staging and surveillance when appropriate. Early detection during dental or medical exams is crucial, since there is no standard population screening program for these cancers. Recent data underscore why timing matters. In the United States for 2025, the American Cancer Society estimates about 59,660 new cases of oral cavity and oropharyngeal cancer and 12,770 deaths. When found at a localized stage, 5-year relative survival is approximately 88.4%, but outcomes fall sharply once disease spreads to regional lymph nodes or distant sites. These figures highlight the value of acting on persistent breath changes and companion symptoms rather than waiting for them to pass. 2. The odor of decomposition. The clue to colorectal cancer. Colorectal cancer ranks among the deadliest cancers, and its earliest warnings are easy to dismiss as routine digestive trouble. One subtle signal is a pronounced lingering fecal odor that resembles decomposition. Tumors can disrupt digestion and microbiome balance, leading to the release of unusual volatile byproducts and gases that reshape the normal scent profile of stool. While day-to-day variations in odor are common with changes in diet or medication, a strong, recurrent, unexplained decomposition like smell deserves attention. This odor often travels with other red flags such as visible or occult blood in the stool, ongoing abdominal pain or cramping, shifts in bowel habits like new constipation or diarrhea, and unintentional weight loss. What makes this disease especially risky is that many symptoms, including odor changes, tend to emerge later in the course. Treat persistent changes as a cue to act rather than a curiosity. Clinicians may recommend stool-based tests, diagnostic colonoscopy to directly visualize and biopsy suspicious areas, and imaging when indicated. Catching disease early matters. In the United States, 5-year relative survival reaches about 91% when colorectal cancer is found at a localized stage, but outcomes decline sharply once it spreads beyond the colon and rectum. The burden is large both in the United States and worldwide. The American Cancer Society projects about 52,900 colorectal cancer deaths in 2025 in the U.S., underscoring the importance of vigilance and timely evaluation. Globally, colorectal cancer is the third most common cancer and the second leading cause of cancer death, responsible for more than 900,000 deaths each year. Screening remains the most powerful way to intercept disease before symptoms escalate. The U.S. Preventive Services Task Force advises beginning routine screening at age 45 for average-risk adults, with strategies that include annual fecal immunochemical testing, stool DNA testing at recommended intervals, or colonoscopy at guideline intervals. People with higher risk due to family history or certain conditions often need earlier or more frequent screening based on medical guidance. Emerging science helps explain why odor can sometimes hint at trouble. Research into volatile organic compounds in stool has shown that composite chemical fingerprints can distinguish colorectal cancer from non-cancer states. A recent analysis reported pooled sensitivity of about 0.86 and specificity of about 0.90 for fecal VOC-based approaches, suggesting promise for future tools, even though these methods are not yet standard for diagnosis. Think of persistent decomposition like odor as one potential clue to share with your clinician, rather than a diagnosis on its own. Staying alert to sustained, unexplained odor changes and pairing that, awareness with evidence-based screening provides your best chance of finding colorectal cancer early when it is most treatable. 3. The sweet that scares the smell of breast cancer. Breast cancer is common in women, and though uncommon, can also occur in men. One unusual clue in more advanced disease is a sweet yet unpleasant scent that may come from the skin or from open, ulcerating areas on or near the tumor. This odor often reflects local tissue breakdown, chronic inflammation, and bacterial overgrowth in a malignant or fungating wound, which can produce distinctive volatile compounds and a noticeable smell that persists despite routine hygiene. Because this scent can be mistaken for an ordinary skin infection or poor hygiene, people sometimes delay care. Do not ignore it if it lingers or returns. Odor is rarely the only warning sign. Breast cancer more often announces itself through a new lump in the breast or underarm, a change in skin texture or color, nipple discharge that is not breast milk, or persistent pain or tenderness in the area. Any combination of these changes, especially when paired with a recurrent sweet, sickly smell from the skin or a wound, should prompt clinical evaluation and diagnostic testing. Timely attention matters in the United States for 2025. The American Cancer Society projects about 316,950 new invasive breast cancers in women and 2,800 in men, with an estimated 42,680 deaths overall. Although male breast cancer accounts for less than 1% of all breast cancers, it does occur. The average man's lifetime risk is roughly 1 in 726. Outcomes are far better when cancer is found early. 5-year relative survival exceeds 99% for localized disease, but falls to about 87% once regional lymph nodes are involved, and to roughly 32% after distant spread. Those figures underscore why new or persistent symptoms deserve rapid assessment rather than watchful waiting. Screening can find many cancers before symptoms appear. The U.S. Preventive Services Task Force currently recommends mammography every other year for women ages 40 through 74, with individual plans for those at higher risk. While odor alone is not a diagnostic test, treating an unusual, persistent sweet smell from the breast area as a cue to seek care can shorten the path to diagnosis and treatment. 4. Sulfur in breath, a sign of stomach cancer. Stomach cancer often hides behind vague, easily overlooked complaints. Yet one striking clue can ride on your breath, a sulfurous odor reminiscent of rotten eggs. When malignancy disrupts normal gastric function, food is not processed efficiently, and volatile sulfur compounds can build up, creating a distinctive, persistent smell. This halitosis typically does not improve with brushing, mouthwash, or simple diet tweaks. Because it can mimic minor problems like reflux or gastritis, the warning is frequently dismissed. Its persistence is what should raise concern. The breath change rarely appears alone. Additional signals may include aching or discomfort in the upper abdomen, an early sense of fullness after small meals, fading appetite, frequent nausea, and, in more advanced illness, the appearance of blood in vomit or dark, tarry stools. Part of what makes gastric cancer so difficult to catch early is that these symptoms resemble far more common, less serious conditions. Noticing a lingering sulfur smell, especially alongside these digestive changes, can be the nudge that prompts timely care. If you detect a continuing shift in breath odor or develop the accompanying symptoms, arrange an evaluation with a gastroenterologist. Early identification opens the door to more effective treatment options and better outcomes, turning a subtle cue into a life-saving head start. 5. The horror of rotten meat skin cancer warning. Skin cancer with melanoma at the forefront is among the most dangerous forms of the disease. It can surface in many ways, and unexpectedly, smell can be one of its signals. In advanced stages, some people notice an odor that recalls rotting flesh or decay. This scent stems from necrosis within cancerous tissue and the release of volatile compounds that create a distinctly unpleasant smell. The effect is most apparent in open, non-healing skin lesions or ulcerated wounds near the tumor, where ongoing breakdown and infection generate the characteristic scent. These injuries are sometimes brushed off as harmless bruises or minor skin problems, allowing critical time to slip by. The warning can also be missed because of where it appears. Lesions may hide on the back, the scalp, or other hard-to-see areas. Even when the odor is present, it is easy to attribute it to hygiene issues, everyday infections, or reactions to cosmetic products rather than recognizing it as a potential marker of something more serious. Other changes often travel alongside odor and deserve equal attention. Watch for shifts in the color, texture, or size of spots and moles. Rapid enlargement, darkening, irregular borders, or bleeding should raise concern and prompt a medical evaluation. When these features accompany a smell reminiscent of decomposing meat, the need for timely diagnosis becomes urgent. Melanoma is particularly lethal if treatment is delayed, but outcomes improve markedly when it is found early. If you notice a persistent, unpleasant scent from a skin wound, do not dismiss it. Schedule an appointment with a dermatologist for a thorough assessment, even if the odor seems minor. In the next topic, we will turn to a less common yet equally alarming sign, the sulfur-like rotten egg smell linked to gastric cancer. 6. An alarm in urine, the smell of ammonia from the kidneys. Kidney cancer often advances quietly, but the body can offer an unusual clue in everyday life: a sharp, pungent ammonia scent in urine. When malignant growth begins to interfere with filtration, the kidneys may struggle to clear metabolic waste efficiently. As compounds such as urea accumulate and break down, they can create a pronounced odor that lingers, signaling that something may be amiss with the body's detox system. Not every ammonia-like smell points to cancer. Urinary tract infections, dehydration, and high-protein eating patterns can also change urine odor. The signal becomes more concerning when the scent persists without a simple explanation or arrives alongside other red flags. People with kidney cancer may notice aching in the back or flank, blood in the urine, profound tiredness, or unintended weight loss. Taken together with a strong ammonia smell, these symptoms deserve prompt attention rather than a wait-and-see approach. Hesitation is common because the symptom can seem minor or embarrassing, but time matters. Kidney cancers identified early are far more likely to be treated successfully. Treat persistent odor changes as useful data from your body. If the smell refuses to fade, appears without a clear cause, or pairs with the warning signs above, schedule a medical evaluation right away. Staying alert to small shifts like urine odor can create a crucial head start on diagnosis and improve the odds of effective treatment. 7. Metal in the air, a danger signal in the blood. A metallic scent can be an unexpected clue tied to cancers of the blood, particularly leukemia and lymphoma. People sometimes notice a tang reminiscent of rusty iron or old coins drifting from the breath or sweat. This peculiar aroma can reflect shifts in iron handling and other chemical imbalances that arise when malignant cells disrupt normal blood cell production and turnover, generating compounds that alter body odor in subtle but persistent ways. The change is most noticeable during or after light activity or whenever sweating increases, yet it is easy to dismiss because the experience is subjective. Many chalk it up to a new soap, a recent meal, or the environment, overlooking that it might be the body's quiet alarm. Odor alone is rarely the only sign. Blood cancers often bring a pattern of symptoms that, taken together, should raise concern. Profound fatigue that does not lift with rest, fevers that linger or keep returning, frequent infections, and unintended weight loss. When a metallic smell accompanies this cluster, the priority should be timely medical evaluation. Leukemia and lymphoma can advance quickly, but the odds of successful treatment rise with early diagnosis. Treat a recurrent metallic odor, especially on the breath or sweat, as actionable information rather than a curiosity. If it persists or appears alongside the other warning signs, seek care without delay. In the next topic, we will turn to a sharper and more easily recognized cue, the ammonia-like smell that can signal trouble in the kidneys. 8. The sweet nobody wants to smell, the smell of lung cancer. Lung cancer is notorious for advancing quietly, often without obvious warning signs, yet, in some cases, a surprising clue surfaces on the breath: a sweet, faintly fruity scent. This aroma arises from volatile organic compounds formed by cancer-altered metabolism within the lungs. As these molecules build up and are exhaled, they create a smell that can resemble overripe or fermenting fruit. Unlike ordinary bad breath, this scent is stubborn. Brushing, rinses, or mints rarely make it disappear for long, and its persistence sets it apart. The signal is easy to overlook, however, because people frequently attribute it to stomach issues or confuse it with odors associated with conditions like diabetes. Treat a recurring, unexplained fruity note as a cue to pay closer attention rather than a quirk to ignore. Other features may travel alongside this odor and should prompt evaluation when they appear together. Watch for a cough that refuses to fade, breathing that feels more difficult than usual, a voice that turns hoarse and stays that way, or discomfort in the chest. When these symptoms accompany a lingering sweet smell on the breath, seeking medical care becomes urgent. Although lung cancer remains among the most lethal cancers, outcomes improve when it is found early. Noticing a consistent fruit-like odor, especially without an obvious cause, and acting on it can shorten the path to diagnosis and treatment. Staying alert to this subtle sign may make a decisive difference. It can be surprising to think that something as faint as a scent might be the earliest alarm for a serious illness. Yet, The body is an extraordinary system that communicates constantly, even through the smallest and most unexpected cues. The odors covered in this video may seem trivial at first glance, but for anyone who pays attention, they can function as critical clues that prompt life-saving action. Early detection is one of the strongest advantages we have against cancer. When you listen to what your body is telling you and respond quickly, you open the door to more time, more treatment options, and better outcomes. Do not brush off persistent odors, unusual changes, or ongoing symptoms. Every moment counts, and protecting your health is worth the effort. If you or someone close to you is noticing any of the signs discussed today, seek medical care right away. Taking action now is an expression of care for yourself and for the people who love you. Life remains our most precious gift. By staying knowledgeable and sharing what you learn, you help raise awareness and encourage others to put their health first. Your body is speaking, the decision is yours. Will you act on these insights or let the signals fade into the background? Do not wait, act now. If this video helped you, please give it a thumbs up, share it with others, and subscribe to our channel, Healthy Care, for more practical tips and potentially life-saving information. Together we can spread awareness and empower more people to take control of their health. Stay informed, stay healthy, and we will see you in the next video.